Hi, welcome to allon4.com, where we provide unbiased, honest, and transparent answers to some of All on 4's most challenging questions. Today we're going to talk about how to pick the right doctor. Full mouth implants or all-on-X implants is a complex procedure with lots of moving parts. This can be very confusing, even overwhelming. We can see my other video that explains the process and different types of procedures. What is even more confusing is knowing who to trust to provide the care with the best results in care for you. First, we need to explain that this procedure takes a team of doctors and staff to make it work. This is the breakdown of my practice. First, there's of course me, a board-certified oral maxillofacial surgeon, and we'll kind of come back to what exactly that means. Then we have a prosthodontist, an anesthesiologist, and oftentimes we work with your dentist, a lab specialist, my nurse, my implant coordinator, my surgical assistant, my treatment plan coordinator. You get the point. All of this being said is it takes a group of experts working together in their field of expertise to get you the results you deserve. All right, let's break this down even further and talk about each role. Let's talk about me as a surgeon. I am responsible for providing all the records to the prosthodontist, creating a surgical plan and executing it while ensuring safety to my patient. The procedures are performed in my office. I am the one who coordinates the treatment between all the other doctors, and it is my office that also manages the lab fees, implants, and finances involved with the procedure. You want a surgeon that is well trained and experienced in these types of procedures because they are the ones that are responsible for creating the foundation on which everything else is built. Now here's the awkward part. I am a board-certified oral maxillofacial surgeon who attended both dental school and a surgical residency program in an accredited facility that's hospital-based. Oral maxillofacial surgeons are the experts in performing surgery to the mouth and face, especially for these type of complex procedures. So why am I emphasizing this? This sounds very redundant. Would you be surprised to know that some of the offices that you see advertised, the doctors claim they are oral surgeons or have special training in oral surgery, but they're actually not even oral surgeons? Let me explain. In the medical community, there are clear guidelines on which procedures can be performed by a doctor or specialty. And in fact, every year when I go reapply for my hospital privileges, I have to submit case logs and to show competency in the procedures that I say I provide to my patients. However, in the dental world, this is not the case. Any dentist can provide any service as long as they feel comfortable with it. Are you serious? That means that a general family dentist that just graduated school last year can perform these complex all-on-X procedures just like an experienced board-certified and oral maxillofacial surgeon. Most patients don't even know this. And now you know why there has been a rise in complications and negative press regarding these procedures. It gets even more confusing. There are multiple subspecialties in dentistry, some accredited and some not. These include a one-year dental residency after dental school called an AEGD, which means Advanced Education General Dentistry, or a GPR, General Practice Residency, or a periodontal residency that's dental school based. This doesn't even include the doctors that take a weekend course and now they think they're experts in providing the service. Look, I really don't have an issue with anybody doing this procedure as long as they have the credentials and the experience and the training to take care of not only the patient during the procedure, but if any complications were to arise, that they can manage them appropriately. Okay, next person on my team is the prosthodontist. They are experts at the prosthesis portion of the procedure. They are involved in shaping, designing, and creating your new smile teeth. They are heavily involved with the lab, making sure that your new smile is not only aesthetic, but functional and harmonious with your other teeth and mouth. They also work with your family dentist, setting them up for success when it comes to the final prosthesis, or the final teeth. The third doctor that is present during all my cases is my anesthesiologist. This is also a confusing topic. Board-certified oral maxillofacial surgeons are the only specialty that has extensive training in administering general anesthesia. However, I still like having an anesthesiologist work with me because then I can solely focus on one task, the surgery, and they can focus on their task, the anesthesia. I feel like this team approach provides better care for my patients. On a side note, our office, we're set up like a surgery center with medical gases plumbed into every room, full anesthesia machine, post-operative registered nurse, etc. I tell you that to say that some dental offices are administering general anesthesia in their dental office that is not equipped for surgery. In my opinion, these offices were never designed to provide surgery, but were designed to provide general dental care. That is all I'm going to say about that. Next would be your general dentist, if you have one. If not, we can complete the case, but we love being able to get your dentist involved. This way, there's continuity of care after the case, and they can perform scheduled periodic maintenance on your new smile. For information about this, see my video discussing how to keep your smile healthy and brilliant. Then there's, of course, the lab and the lab technician team. They are responsible for organizing the records, discussing the differences and the nuances in the case with the surgeon and the prosthodontist. They complete a digital wax-up of your smile, and being able to transmit electronically, we can then meet via Zoom, and we can also use some of the best labs in the United States because we can digitally submit data back and forth. Finally, there's, of course, my staff. I'm very blessed to have such a wonderful and experienced staff. They are crucial to making every aspect of your experience great. We have a postoperative registered nurse, surgical assistants, my implant coordinator, and my admin team. I hope you can see how all these procedures are best treated using a team approach, utilizing a specialist in each of their respective fields. A word of caution: always ask lots of questions about who is the one actually performing your surgery. Also ask if your doctor is local. Unfortunately, some surgeons travel city to city performing surgeries on different days, making it difficult if you need postoperative care or having to see another doctor that wasn't the one who actually performed the surgery. I will finish with this statement. Would you rather have a fine-tuned, experienced orchestra or team managing and performing your case, or would you rather have a one-man band that thinks they can do it all? Thank you.